You've got a scoreboard for finance, sales, and operations. But for employee benefits, the second largest people expense, there probably isn't one. That's the gap. I've worked with dozens of mid-sized companies who all had the same blind spot. They were spending millions on health insurance but had no way to measure whether that investment was paying off. Year after year, the renewal arrives, costs jump, double digits, and leadership reacts, but never really manages. In this video, I'm going to show you how to create KPIs or key performance indicators that will turn your benefit strategy into something you can actually measure, manage, and improve. Because if you can't measure it, you can't manage it. Think about it. Every other area of your business has a scoreboard. Finance tracks margins and cash flow. Sales tracks pipelines and close rates. Operations tracks uptime and output. But when it comes to employee benefits, for most employers, the only scoreboard is the renewal notice. That's not strategy. That's surrender. Without KPIs, leadership has no way to know if the plan is running above or below medical inflation, engaging employees in preventative care, or delivering actual ROI compared to the dollars being spent. And here's the real kicker. Employee benefits are usually your second largest people expense after payroll, yet it's the only area without a management dashboard. KPIs close this gap, and they give CFOs early warning signs before claims explode. They give HR visibility into whether employees actually value and use the benefits, and they give leadership the confidence to manage, not just react when it comes to health plans. When we build a benefits scorecard, we boil it down into three simple buckets. Financial metrics, for example, per employee per year costs, is it trending up or down? Monthly loss ratio, how much of your funding is going out in claims versus fixed costs? Or RX spend as a percentage of total claims. The national average is around 20 to 25%. If you're well above that, pharmacy costs are driving the overspend. Second bucket is utilization metrics. This might be preventative visits. What percentage of employees are getting checkups and screenings? Or maybe generic versus brand RX fill rate. A higher generic use equals lower cost trends. Or possibly telehealth usage. If you're paying for it but nobody's using it, that's just waste. And the third bucket, employee experience metrics. This could look like benefit satisfaction score. Maybe you send out pulse surveys to tell you if employees even value the plan. Or possibly a benefits net promoter score. Would they recommend this coverage to a friend? Or maybe perceived affordability. Simple survey question. Do you feel that healthcare is affordable under this plan? That's it. Financial tells you if the plan is sustainable. Utilization shows you if employees are using it. And experience shows you if it's actually valued. Without all three, you're just guessing. KPIs only really matter if you know what good looks like. Here's a few simple benchmarks that we use with our clients. For financial targets, this might be your per employee per year cost trend. If you're trending above 5% a year, you're above medical inflation and may need a strategy reset. Or your monthly loss ratio target should be between 85 to 95%. Below that, you're likely overfunding. Above that, you're underfunded and you're probably going to be exposed to some stop loss hits. Or your RX spend as a percentage of your total claims, with the national average being between 20 and 25%. Anything higher and your pharmacy costs are driving the overspend. Then when it comes to utilization targets, maybe look at preventative care compliance. If at least 70% of employees are completing checkups and screenings, you're in a good spot. Lower than that, you should expect chronic claims to rise, or possibly your generic RX fill rate. 85% or higher is a good target. Every percent below that costs you real dollars. And then when it comes to your telehealth usage, aim for at least 15% of visits. If it's near zero, employees aren't using a benefit and you're paying for it. For your employee experience targets, on your satisfaction surveys, aim for a positive response 70% of the time. With your benefits net promoter score, a score above 50 shows employees value your plan. Or perceived affordability. If more than a quarter of your employees say healthcare feels unaffordable, expect turnover or disengagement. These aren't just numbers, they're guardrails. They let you know whether your benefit strategy is delivering value or quietly draining your budget. Numbers by themselves won't move the needle, but action behind the numbers does. Here's how the employers that we work with use KPIs to actually steer their benefit strategy. It starts with quarterly reviews. Don't wait until your renewal. Review your KPIs every quarter. Track your per member per month costs as claims come in, along with preventative care and RX usage. When it comes to vendor accountability, tie a KPI to every vendor, TPA, PBM, even your network should tie back to a KPI. Is the PBM keeping your RX spend under 25% of claims? Is your TPA flagging high-cost claims early? Or is your care navigation vendor actually improving preventative compliance? If they're not moving the numbers, they're not adding value. When it comes to strategy alignment, KPIs aren't just about this year. They tie directly into your 3 to 5 year benefit strategy. If you want to hold cost growth below medical inflation, watch your PMPM trend. If you want a healthier workforce, track your preventative compliance. If you want better retention, track affordability perception. And here's the big advantage. With level funded or self-funded health plans, you can actually get this data. And what you can't get, you can create solutions for it. You can measure, manage, and adjust. With a fully insured plan, you're just blind. The carrier keeps the scoreboard. KPIs give you the power to manage your second largest expense the same way you manage sales, operations, or cash flow, proactively. Here's the takeaway, guys. Without KPIs, you're not managing a benefit strategy. You're just reacting to renewal numbers. KPIs give you clarity. They show you whether your plan is trending above or below inflation, whether employees are using benefits the right way, and whether the dollars that you're spending are actually improving outcomes. If you don't have KPIs in place today, I suggest that you start small. Pick just 3, maybe 1 financial, 1 utilization, and 1 employee experience, and begin tracking these. Even this simple scorecard will change the way that your leadership team makes decisions. I'm Rich with Benesmart, and this is exactly what we help employers build. Self-funded and level-funded health insurance strategies that are measurable, actionable, and designed to deliver real results. If you're ready to put a scoreboard behind your benefit strategy, reach out and let's build one together.